Good afternoon, everyone. Thank you for joining. We are going to get started here this afternoon. My name is Mary Beth Marks, and I am the program manager for the Ohio COVID-19 Child Care Study, and do want to take a moment just to thank each and every one of you for taking the time to join us this afternoon. Before we do get started, simply wanting to take a moment to just go over a little bit of this webinar etiquette and troubleshooting. Please note we actually have disabled your videos, so we'll have our presenters via video, but feel free to keep both your video and your audio muted. As a reminder, we are welcoming questions throughout the course of this webinar, either via the chat or the Q&A tool. So please do submit those questions and know that we will be following up with the answers to any of those questions in follow-up to this webinar. So should you need any additional troubleshooting during this session, know that our team is monitoring the email address at covidchildcarestudy@case.edu. So if you experience any troubleshooting or technical challenges during this webinar, please reach out via that email address. Now, given our brief time together, I thought I would give just a quick overview of our agenda. We are going to take a few minutes to meet the study team, and they will also walk you through both an overview of the study as well as the key study activities. And most importantly, perhaps, we will give you a snapshot of the next steps that will be taking place as soon as this study officially kicks off following this webinar. As a reminder, throughout the duration of this webinar, don't hesitate to submit those questions via the chat or Q&A. And so first, before we begin, I have the opportunity to welcome Mindy Kowalski from the Ohio Department of Job and Family Services, who has just a few brief comments to share with you this afternoon. So Mindy, thank you for joining.
Thanks. Good afternoon, everyone. My name is Mindy Kowalski. I am the Assistant Deputy Director at JFS. And I just wanted to start off by saying that I cannot extend how much we appreciate you all participating in this study. The importance of this study, I cannot state enough. And the fact that each one of you are willing to partake in it means the most to us. You are not only helping the state of Ohio, but this study is probably going to end up nationally. So I appreciate every one of you taking the time to be part of this. And I know that these unprecedented times have caused a lot of stress and anxiety for a lot of people. So we appreciate everything that you guys have done and sticking with us through this whole process, because we've made a lot of changes and you all have had to adapt, and you've done a great job. I would like to let you guys know a few things. Around the study, Case Western is going to be your main contact. However, we are their support system. So if you do have any questions or you can't find their information, you are more than welcome to email us. And you can email us at odjfs_childcare@jfs.ohio.gov. Additionally, if you all are familiar with, if you go to jfs.ohio.gov, up in the right-hand corner, there's a bunch of programs listed around the top. Childcare is the last program. If you click onto that link, it'll take you to pandemic sites for both families and for programs. And I would like to, and I encourage you all to go to that website. We are updating it on a weekly basis. We are trying to keep on top of everything that's happening. There's resources that aren't just for JFS. There are resources about health, about mental health, about how you guys can help with inside your classrooms. So we are trying to give you resources during the pandemic outside of, our day-to-day regulations. So I encourage you to please go to that website. I also encourage you to have your families go to those websites, because we are providing on that website a family page as well. And on that family page, it tells about how families can talk to their children about COVID. How can, as a family, if I'm looking at my child care, what are some of the things I should look at, and what are the things should I be concerned with? So there are some great resources. And like I said, we are trying to keep those up to date as possible. And we are a partner with you all on this. And so I just wanted to let you know we are here for you. And again, I want to thank you for your support and participation in this study. And I am going to turn it over to Darcy and Mary Beth, and they have been doing a phenomenal job. So please, they are here for you as well. Thank you.
Thank you for that, Mindy. And as Mindy just alluded to, I have the pleasure of now introducing you to Dr. Darcy Friedman. She is the director of the Marianne Swetland Center for Environmental Health and is serving as the principal investigator of this study. And we are grateful to have Darcy joining us today. So please join me in welcoming Dr. Friedman.
Okay, I just needed to unmute. Thank you, Mary Beth. Thank you, Mindy. It is so great to be here with each of you today online, representing your childcare programs from across the state of Ohio. And I want to say that I'm coming here today not only as a researcher, but also as a parent. And it's just been an honor to be able to work with the state to plan this study. And it is an honor to be able to work with each of you to roll it out. I know that childcare is a fundamental support in our community, across our state, across our country. We all have become even more aware of the importance of this resource in our communities. And like Mindy said, the results of this study are going to be foundational for our state, but they will also be of guidance to people from around the country. To begin, I want to reiterate the comments from JFS and thank you for your support and participation. Given the timeline of this study and the rapidly changing environment in which we're working in, I'm grateful to have our chance today, right now, to be able to share a little bit more of the background about our study. As we previously shared, this study is being conducted by researchers at Case Western Reserve University in Cleveland. The research is funded by the Ohio Bureau of Workers' Compensation and is conducted in partnership with Ohio Department of Job and Family Services. In assembling our team, we made it a priority to focus on building a team of researchers with extensive experience conducting community-based research across Ohio, including primary data collection using diverse methods with families and children. In addition, our team includes experts in child health and well-being, environmental health, epidemiology, as well as infectious disease management and control. As has been previously mentioned, our study goal, or our goal today, is to address some of the questions that you all shared as you were expressing interest to join the study. We hope to address most of those during our time today, but do encourage you to follow up with our team if anything is unclear at the conclusion of today's session. This study is being conducted in 10 counties in Ohio. It is designed to better understand how to lower the spread of COVID-19 and lessen the impact of COVID-19 among families and staff affiliated with child care programs in our state. Please note, in any study report, we will not include any data that will make it possible to identify an individual participant or a child care program. Here is a detailed overview of the participating counties. When selecting counties, we sought to have variability in key factors, including the population size, racial makeup, COVID-19 risk, and then the number of child care programs. These 10 counties are home to more than 2/3 of all child care programs in the state of Ohio that were in operation prior to March 2020, when COVID-19 was declared a public health emergency. Within these 10 counties, we invited 100 child care programs to join the study. These programs, including yours, were randomly selected. Our goal was to enroll 35 family child care home providers, type A and B, and 65 child care centers. More programs were selected from counties with higher numbers of child care programs. We designed the study in a way that will help us address the following questions. First, what is the prevalence of COVID-19 among staff and children and parents in a random sample of child care centers in Ohio? Second, What factors drive the spread of COVID-19 in childcare settings in diverse contexts in Ohio? Third, what are the perceptions of risk and safety among parents and caregivers and staff from childcare programs in Ohio following reopening after COVID-19 was declared a public health emergency? And fourth, what are the levels of child and caregiver stress and coping in response to COVID-19? And how do these vary based on sociodemographic characteristics? In order to answer these research questions, we've developed 6 key study activities. Please note, not every participant will complete all 6 activities. In fact, most people will only do 1 or 2 of these activities. We have noted the participants and frequency in each of the coming slides. So here you can see the 6 components of the study, and I'm going to walk through these in a bit more detail in the coming slides. All childcare programs in the study will provide a once per week log of temperatures for staff and children attending the childcare program. These will be done each Tuesday, thus we're calling it Temperature Tuesdays. We will provide a template for recording the weekly temperature log, and it will be an anonymous record of all temperatures recorded for that day. At the end of the study, the program administrator from your site will receive a $50 gift card to compensate for your time and effort with this part of the study. All interested participants are required to complete a one-time enrollment survey to begin study activities. This is the entree ramp to join all other study activities. Once enrolled, each participant will receive a weekly online health survey about signs and symptoms related to COVID-19. This survey will take less than 5 minutes to complete. The survey will be sent to each participant every Friday throughout the duration of the study. To promote participation, we will do a weekly draw for 10 $25 Amazon gift cards to participants who complete their weekly survey by the Sunday evening of the week. So they get it on Friday. If they complete by Sunday, they would be in the draw. Those who completed at least 4 surveys during the course of the study will be entered into an additional drawing for $25 Amazon gift cards. Once all participants have enrolled in the study, an estimated 300 participants, including parents and caregivers, will be randomly selected to complete one online survey. The survey will include questions about the household, COVID-19, social distancing, and so on. Participants will be compensated a $25 gift card for their time and effort. We also want to capture more detailed feedback through interviews. We plan to randomly select 20 parents and caregivers and 12 staff to participate in one interview, which will take place over the phone or on Zoom like this. The interview questions focus on how they are managing life and childcare since COVID-19 was declared a public health emergency during this time. Participants will receive a $50 Amazon gift card for completing the interview. As a participating program in the study, each child care program administrator or leader will share your emergency plan or your communicable disease plan or COVID-19 written plan with the team. Some of you have already shared yours, so we've already accomplished that part of the study. In addition, we are going to hold focus groups to hear more from administrators or leaders to find out what is it like to operate a child care program since COVID-19. All participants in the focus groups will receive $50 for completing the focus group. And finally, we are offering free COVID-19 testing as a part of the study. Beginning in mid-September, all child care center staff all child care program staff will have a chance to be tested for COVID-19. COVID-19 testing will be done on a single day, or if there's a lot of people at your site, it may be done on more than one day at your child care center facility using an FDA-approved self-testing kit from the company called Let's Get Checked. So self-testing means that staff will actually test themselves and secure their materials into their own package on site. The test should take no more than 15 minutes from start to finish, including enrolling and completing the sample. They will get their results within 4 days of testing, and staff will receive $50 for volunteering to complete COVID-19 testing. The details for COVID-19 testing for parents and caregivers and children are still being worked out, and we'll be sharing those details with you soon. For planning purposes, please note that all study activities are scheduled to begin later this month and will conclude by the beginning of October. This fast-paced timeline provides opportunities for the information collected from our study to guide future decision-making in the state of Ohio as well as beyond. Given this expedited timeline, I want to share an overview of the onboarding schedule to officially begin the study activities at each child care program. Each program will be onboarded into our study based on your county. We'll begin with Ashtabula, Butler, Cuyahoga, and Summit counties starting on Monday, August the 17th. Following this webinar, you will receive an email from the onboarding team from Case Western. They will be reaching out to you to set up a 30-minute call, and during the call, they will review more details about the study and will provide materials for you to announce the study to your staff and families. And you can go to the next slide. Please know that you are a key part of the process for getting people to take part in the Ohio COVID-19 child care study. As you prepare to begin this study at your site, we encourage you to assemble a list of email addresses for all staff and families at your program. Following your onboarding session, you will use these lists to share study materials with staff and family. We'll be providing those materials to you next week. So at this time, I want to first thank you one more time for your support and express our extreme excitement in being able to work with you. And I want to now, I believe we do have time to take a few questions. Mary Beth?
Thank you again. So we have been accepting your questions, and the first question I would like to know is, if I was interested in sharing these materials with any members of my team, will all of this be captured in addition to the webinar for this information to be shared with our team and families?
Yes, so following today, you're going to receive an email with a link to the webinar as well as the slides. And in that onboarding process, you will also receive, a personalized email for your center that has specific materials that you'll be able to share to people at your site.
Great. At this time, these are the only questions we have received in from our chat session. We do have a question that just came in regarding the length of the study. So how long each participating program will be participating in the study.
Great. So the study will begin starting next week, depending on your site, and then it will go through the beginning part of October. There may be some final things that come in throughout the month of October, but our goal is to prepare a report that will go to our funders, Ohio Bureau of Workers' Compensation, our partner, Ohio Department of Job and Family Services, as well as a report that will go to all 100 child care programs that take part in the study.
We also have some questions just regarding the administering of the COVID-19 test. So will additional instructions be provided regarding that element of the study?
Absolutely. So we're not going into a lot of those details now because COVID-19 testing won't happen until probably around the middle of September, no sooner than September 9th. But just to give you a little sneak peek, if you want to go online, just Google Let's Get Checked. You can see materials and read about Let's Get Checked. It is available to the public. In this study, we'll be providing it to your sites at no cost, but anyone in the public could actually go online and seek a test. The test is actually, you may have heard of a couple of things in the news recently about testing, antibody testing versus virus testing. We are using a PCR virus testing approach, or it's considered to be the gold standard way to measure whether or not somebody has the virus that causes COVID-19 in their body. So we're using a test for the virus. We are not testing for the antibody. You may have also heard of testing that requires you to go way back in your nose, the nasopharyngeal area. In our test, and pretty much all self-administered tests that are approved by the FDA right now, you're just using the front part of your nose, so the front nasal cavity. There really isn't any pain or discomfort. It might be a little bit awkward to put a swab inside of your nose, but it is not painful to do that. So all of the details will be shared with you about testing, some more during your onboarding, and then definitely as we get closer to September, we'll start to share a lot more detail with your site. And in fact, we'll be mailing to your site the package that includes all of the tests for the people at your site who are agreeing to be in the study.
Thank you. And while we're on the topic of testing, a question has been raised if individuals who have already been tested will need to be tested again.
Yes, so we are testing everybody during that moment in time. And the reason why we're doing that is to get at this idea of prevalence, or how many people have COVID-19 and that maybe really didn't know about it. So in our testing, we're not testing people who think that they're sick. If you think you are sick with COVID-19, you should follow your procedures with your healthcare provider and take the proper steps to be tested. We are doing what's called asymptomatic testing. So we're testing people who don't think they're sick. If you've been following the news, you've probably seen that COVID-19 is this interesting virus, in part because it has such extreme expressions. On the one hand, you have extreme severity and people in the ICU, and on the other, and it's nearly 50%, are people who don't even have any symptoms at all. And so in our study, we'll be looking at more of that asymptomatic response to COVID-19.
Thank you. And Darcy, can you please reiterate how long it will take for those test results to come back, given the testing protocol we're planning to use?
Yes, so the test results on the day of testing, the materials will be mailed. And once they get to the site, which should be within 24 hours, results should come, within 4 days. In fact, it probably will be less than 4 days, but we're saying in the study about 4 days. The way that people will get their results is you'll actually log into a system, either on a computer or on your phone, and the system will alert you if you do have a result. So again, that's all individually done. And if you happen to have a positive result, you will receive a call from the Let's Get Checked nurse, and they will review your result, share more information. Similarly, if your test result is indeterminate, which is an unlikely result, but it could happen, they will also be contacting the person to let them know their results. And at any time through Let's Get Checked, somebody who was tested through the system can actually contact the nurse from that organization and get feedback and answer any questions they may have.
Thank you. With the time remaining, I did want to ask a question that has come up a few times here, simply regarding enrollment and participation. Does each program need to have 100% participation from staff and family members, or could you speak more to the enrollment process?
Yes. So like I said earlier, even though there are 6 study activities, most people are really doing one of those, which is the enrollment, and then doing that weekly health attestation, as well as the temperature. The temperature is really, because it's anonymous data, as a participant, you don't really have to enroll in that part of the study. It's just a record of the temperatures that are at your site. But we would love to have as many people at your site enroll as possible. It'd be amazing if we had 100% enrollment. We know that not everybody's going to be interested. It is a totally voluntary study. People have various obligations or time commitments that will allow them to engage. So, we know that it's highly unlikely that we'll have 100%. But the more people that enroll, the more representative our study is of families and staff from childcare programs across the state of Ohio, which is really the goal. Ultimately, our goal is to be able to say, we're not just reflecting one site in one county in Ohio, but we're trying to draw on a broader understanding of what's going on across our state.
And just to clarify, is there a separate consent and enrollment for each of these study components, really just touching on the concerns regarding parent consent for children participating in the study?
Yes, so each element of the study would have its own consent process, its own invitation process. So if somebody is interested in doing one piece of the study but not another, they would be signing and off on various consent forms for that.
Great. And is the expectation that one or both parents in a two-parent household complete the weekly health attestation, or is it simply one parent per child?
We would expect that one parent or caregiver per family would complete the assessment.
Great. Well, we certainly want to be mindful of everyone's time here. I believe we have captured the feedback and questions that have been shared during the Q&A. Once again, this recording will be made available to those who were unable to participate, as well as other team members or families that may be interested in these additional details. So that link will be shared with you. And as Dr. Friedman mentioned, the next step for you and your program's participation will be a direct email from the onboarding team to schedule a brief conversation and to really begin to kick off the study on site at your individual program. So we certainly thank you again. And as we move forward with this study, please don't hesitate to contact either the study team based at Case Western or the team at JFS.
Great. Thank you all for joining us today. We look forward to working with your programs, and have a great weekend. Take care.